you're in for a real treat again. Lots of preparation has gone into the show. I've got someone waiting to just explode because she's so passionate. Her name is Refilwe. I'm going to introduce her just now, and we're going to be talking about exclusive breastfeeding and the working mother from research findings and also from personal experience. Now, Refilwe is also a midwife, so really hang in there. She's going to come in just now. But while we're waiting for more people to come in and join us, just a few announcements and welcomes. So remember that this Facebook Live show is not about me, it's all about you, it's to serve you and whoever is out there listening to us. So if you have any specific topics or questions that you would like to see addressed, you can reach out to us, send it through Facebook, our messenger, or send us an email at info@sisterlilliancenter.co.za. Or if you are a healthcare provider yourself, if you are a midwife that has, just as Refilwe, reached out to us saying, listen, I've done this amazing research, I've got a topic burning on my heart, then please reach out to us and you can become a guest of this show. So then you can email me at info@sensitivemidwifery.co.za. And then also just a few announcements. This is for any birth worker, midwife, lactation consultant, doula, doctor, chiropractor, anyone out there that's involved in maternal health. I've got a real exciting announcement to make, and I would like to show you also on the screen just now. But we've relaunched our membership packages on Sensitive Midwifery website. It's just, we're really building a way to serve you to the best of our abilities here. And so you can, there are different membership options. You can become a Midwife Plus member if that's for midwives working in any sector, private sector, public sector, anywhere in the world even, you know, but it's just, if you become a member, you've got access to our membership portal, and there's some real great material for you to help you to be a sensitive midwife wherever you find yourself working. And then there's an option for independent midwife practitioners, anyone that is actively involved with antenatal care, private practice, or births, postnatal care, lactation consultant, and so forth. But you are a South African registered nurse midwife, and you have an own practice number, then this is for you. And there's also, when you come into the membership portal, there is a independent midwife toolkit with all the stuff that you need to know and how to set up, but also once you're already running a practice, how to deal with medical aids and set up invoices and so forth. And there's a beautiful community, forums, active forums that we'll be chatting on different topics. And just keep you up to date. Part of the membership is now also that you have a membership with the Society of Private Nurse Practitioners, so we're really collaborating. So watch the space, it's very exciting. I would say sign up. The links to the website will be in our comments. Have a look out for that. And then there's also the benefit that your services will be listed on both Sensitive Midwifery and Sister Lillian Center websites. So that is just where people can find you and your services if they're looking for beautiful sensitive midwives out there, or independent midwife practitioners and doulas. For the doulas and allied healthcare professionals, we really want you to be part of the community too, and there's a space for you too. Just go to the Allied Healthcare Professional tab, and you also will get access to good resources and be listed on our website. Okay, so that was it for today. Check it out, and I can't wait to get going on today's topic. So just a word before we start talking. Breastfeeding is a massive topic. We can talk days and days and days about it. There's so many angles we can take. If we just start talking about the benefits of breastfeeding, then the sky's the limit. And then there's a whole lot of things on how to breastfeed and how to, all that sort of technical stuff. But that is not the purpose of today. That we have to just stay in the topic of today, and that is on exclusive breastfeeding and the working mom. So when you go back to work and the challenges we're facing out there. We know that World Health Organization and the United Nations Children's Fund recommend that babies begin breastfeeding with the first hour of life within. It's super important, and continue breastfeeding exclusively. Now that exclusively means no solids and no other milk or formula. exclusively for 6 months, and that is what is recommended. Now the reality, although we know that it's so important and that it's recommended, the reality is that about 40% of infants under 6 months are exclusively breastfed. So it's only 40%. And less than 20% of infants are breastfed for 12 months in high-income countries. And then only 67% of infants in low and middle-income countries receive any breast milk between 6 months and 2 years of age. So that is the other recommendation. I jumped over that, but at 6 months of age, parents can introduce safe, nutritious, and age-appropriate complementary foods while continue to breastfeed up to 2 years at least of age and beyond. So that is a recommendation, and that is what we all should strive through, and that is sort of our baseline when we start talking about this topic today. Now for today, I first also want to thank our sponsor that made it possible that we can do these things, and today's sponsor is Simplex, and specifically we want to talk about Simplex calcium chewable tablets. Now this special tablet also contains vitamin D3. Now we know that calcium is an essential mineral that is necessary for the development and maintenance of strong and healthy bones and teeth. Vitamin D3 is also the sunshine vitamin and is needed by the body to transport and absorb calcium into the bones and joints. Now the combination of calcium and vitamin D3 is effective in treating calcium deficiency and may reduce the risk of developing osteoporosis. Extra important when we are breastfeeding and when we are pregnant, we need extra calcium, because we do know that otherwise it gets taken out of our bones and our teeth. My mom says one child, one tooth, but the good thing is that it will reverse after when you're not pregnant anymore, but calcium is an important mineral and you need about 1,000 milligrams a day. That's recommended. Okay. So that's enough talk for me today. I'm going to add Refilwe in here on my right. There she is. Hi, Refilwe. Welcome to the show today. Oh, I must unmute you. There we go. Hi, Refilwe. Let's try that again. There you are. We can hear you.
How are you?
Very well. How are you?
I'm fine, thanks. And yourself?
Yeah, I'm so good. Refilwe, I'm so happy that you reached out and that you wanted to come in the show. You've got so much important things that you would love to share today with our audience. But before I give you finally the word, I want to introduce you officially, and you are just a vibrant professional midwife and absolute passionate about what you do. It just oozes out of you. And you've recently also finished your master's in Advanced Midwifery and Neonatal Nursing Science, and congratulations on that. And part of that postgrad degree is that you need to do a research. And I know everything about research. It's not for sissies, so well done on finishing that. And we need academic voices, midwives to be academic voices out there, so I'm super proud of you. And your special interest was on exclusive breastfeeding. And you have done research to find out what is the experiences, and the reason why you wanted to research is that you noticed that even though World Health Organization says this is what we need to do, in the 21st century, all the working moms go back to work and they don't get supported to do what they need to do, and that's exclusive breastfeeding, and that was a real challenge for you. And then you became pregnant yourself, and you're a mom and a midwife, and you went through that same experience. So welcome, and start telling us a little bit about your own experiences in this journey.
Thank you for having me. I would like to first greet the audience. Really, being a new mom, I have a 7-month-old son at the moment. I'm a working mother myself, and it is really an experience and a half being a working mother and exclusively breastfeeding. So everything, juggling the long hours, juggling where you have to express your milk, and juggling where to store it. It is just a nightmare. So in instances, I went back to work this year, January. My baby was already 5 months. My baby was exclusively breastfeeding for 5 months. And believe it or not, my family was appalled. They couldn't believe that a baby can actually survive on only breast milk for 5 months. They were just fighting with me that you are not giving your baby enough nutrition, because it is believed that the baby is supposed to be supplemented with formula at the as early age as 1 month. So really the support of your family members is important. But because I had the knowledge, and because I'm actually very stubborn, I exclusively breastfed my baby for 5 months. Now, when I had to return back to work, it was a reality on its own. I worked in a public hospital where there are no lactation rooms. Um, I worked long hours. I worked 12-hour shift, day shift. I also worked night shift. So you can imagine when you're away from your baby for that long and you are used to exclusively breastfeeding your baby, you are just having anxieties and nightmares. Your breasts are full, are engorged, and there's actually no place that you can express because there's no privacy. So I ended up going into the neonatal unit, where in our hospital they've got a breast milk donor bank. So I went, I registered, and I expressed my milk because it was a lot of milk. I expressed it for the donation, and also I expressed for my baby. So yeah, it was a challenge.
Wow. Let me come in. Wow, that was quite a story. So you have had first your own experience, but you were also a midwife and you were a researcher. So you obviously there was a lot of things happening inside of you. Like now you're this battling mother, realizing the reality. So what? How can you link it in with your research findings? What are your own experiences? How did it tie in with what you find in the research? You want to share a little bit about that?
My research, the title of my research, amazingly, it was Working Mothers' Experience of Adhering to Exclusive Breastfeeding. So before I became pregnant, I actually did the research. Doing the research, I was intrigued that as a midwife, we would give health education on exclusive breastfeeding, the benefits. But for the working mothers, it was quite a challenge because whenever you would consult a working mother, they would just tell you that, I just left it because I work away from the baby, or I'm away for too long and then my breast become full. I don't know what to do. I don't know where to express. I don't know how to express. Um, they don't even know how to store the milk. So I was intrigued that mothers, they came in, they are also afraid to ask us as midwives. Even in the waiting areas, there are no visual aids to show them how to store, how to express. And in the midst of being too busy to engage with the patients because of so many constraints, patients or mothers, they always mix feed. It will lead to that because they don't know what to do. So in my research, I went about it and I found out that your average mother, just like I am, will work long hours. Where we work, there are no luxuries of having lactation rooms. And wherever we had our time to express, we expressed in undesignated places for expressing, such as bathrooms, staff kitchens, where everybody can just barge in and see you in the act of expressing. And apparently, expressing is supposed to be a private session where you sit down and you are in a relaxed environment where you can let the milk flow and you can express.
Yeah. Okay.
Yeah.
Oh, I want you still in there. Okay, thanks, Refilwe, for sharing those experiences on your research findings and your own. You said so many things that I would like to unpack a little bit, that we can now start helping and empowering our audience. And our audience is definitely the one side, the healthcare professionals, and the other side is the moms, and we're all one unit, right? And as healthcare professionals, let's just start there. You mentioned a bit as midwives when we there is a lack of support maybe to help moms with the breastfeeding. So from us as midwives ourselves, we may be failing here and there with supporting our moms in this journey. Do you want to expand a bit on that?
Definitely. When I unpacked with my participants and asked them, when you don't know or you lack knowledge in expressing your breast milk, why don't you ask the sister? There would be, the answers that I got was, they don't know which midwife to ask because many of them are doing different things. The other one is consulting sick babies. The other one is doing the immunizations. So it's different people at different times. And in the public sector, unlike the private sector, there is no luxury of breastfeeding consultants. There's not that luxury. So the professional nurse or midwife that is consulting the mother is usually doing everything in one. But in that instance, also neglecting on asking the mother, how are you coping with breastfeeding? Are you expressing? Do you actually know how to express? Do you know how to store the milk well within the consulting room? So those are the type of platforms where you actually get to engage with the mother. That's where you'll find out that most of us, I'm going to include myself, most of us mothers, we are afraid to ask. And being afraid to ask, you get advice from out there in the community, from the person who's just crossing the road to maybe mix feed or give baby solid before time, before 6 months. And then that's what the mother is going to do because they are afraid to ask their midwives.
Okay, so that is a real issue, that you find that the access to good advice is lacking, and to sound advice, and that midwives in hospital settings are obviously very busy. Now we are just backtracking a little bit because we're talking here when you've just given birth. So I don't want to talk too much about this because we want to get to that topic of getting back to work and now being a working mom, and but it's always so important that breastfeeding comes from a good start. So and that support is so important. That is really key in your story, is the importance of support right through the journey and with the right advice. So I think what we would like to encourage our midwives that are working, even if they're working in very busy settings, scenarios, I think sometimes we use our busyness as an excuse to get on with breastfeeding support and education, and there's definitely ways that we can get around it. Get all your postnatal moms in a group and educate them at the same time before they get discharged. I've seen that happen. There's definitely ways that we can go about it. It's part of our job. Don't say, no, now you need to become a lactation consultant. Breastfeeding advice, knowing how it works, having the right advice is part and parcel of being a midwife. So if you feel you're not up to scratch with that knowledge, make sure you do get that knowledge and empower yourself, and that you advise. It is so crucial. Birth, pregnancy, birth, breastfeeding, postnatal care, it's all interlinked. It's all wherever you find yourself in that line, it's going to affect down the line. So you need to take your full responsibility and do your education and empowerment right, and make sure you do up-to-date evidence-based information and support. But as I said, we can talk so much about all of that. So let's just go from the support. Now you've established breastfeeding, you're up and running, and exclusive breastfeeding is what we need to do. It's the thing to do up till 6 months. For you, it was 5 months. I think it differs a bit per child, per baby. But then the reality is most of our mommies are working moms and need to get back to work. How did that work for you? How did you go about it? What did you do? How did you face it? And give us some real good tips out there for the listeners.
First tip would be, before you return back to work, I think you should find out your working schedule so that you are able to maneuver how you are going to express. Mothers who are really adamant that they want to express, and there are no lactation rooms, usually you just have to find a spot for yourself. Like maybe when you with your colleagues, you can ask them that, can I express between these two times during the day or during your work schedules? And then they can agree. That's the one form of support from your work. And one thing that women should know that are working, that there is a code of conduct by the Department of Labor that a mother can receive 30 minutes breaks within his working schedule to go and express. So you can, before you return back to work, you can just talk to your manager about that and see how you can maneuver around it so that you are able to express between those two times, those 30 minutes break, you can use them, because you have to be relaxed to express and you have to have privacy. The other thing that I would advise is that also support from your family members is very crucial, because if your family members don't believe in exclusive breastfeeding and they don't regard expressing milk as an important thing, it will fail, because they will be introducing solid or feeds or formula behind your back, meaning that when you have left your baby with a grandmother or an aunt or your mother, if you're not on the same page that, you know what, this is what I want to do, then they are going to introduce food and solids and all those things without your knowledge. You understand? So that support is very important, that you are supported by your family and you are supported at work. In instances where there are no lactation rooms, like where I work, there's no lactation rooms. You can ask your manager politely if they can give you or borrow you their office so that you can have privacy to express. Some women have gone to great lengths. They express in their cars. So meaning that you have to have a sanitizer there and then you express in your car. And then the storage part is very important, because you have to store it in the fridge. And the most common fridge that women used, even in my research, even I used, was the fridge where we all put our food. But you just have to have a cooler box with it, cooler box, and store in the milk for your baby and put it in the cooler box so that it is safe. So nobody can use it and pour tea and use the express breast milk because it can happen.
Oh, wow,
So,
fantastic. Yeah. No, you've said so many important things. I need to rephrase a few of them. Okay, so first of all, it's very important for all our moms listening that go back to work that you know that it's in the law. They need to give you time to express breastfeeding, so it's your right. So if they are being difficult with you, you really can you can maybe reach out to us to ask us where in the law is that we can give it to you. But if you have a difficult employer that is not wanting you to express milk, then you can stand on your right. So that's very important to know. And then it's also a reality that the environment is not catering for it. And I know that as women are very inventive and we make a plan. So even if it is in your car or in storage rooms or wherever it is, make a plan. But if you can be a leader and maybe ask and be bold and ask for a beautiful environment for it, that you can support women all over the show that will come after you, that it will become just a norm. It should be so part of society and so normal that that's part of what a mother does, right? And as you said, 21st century, come on guys, we should know better by now. And all of us are working, most of us, so we just need to get on with it. And then I also really want to emphasize again the matter of seeing who's looking after your child at home, because now you're going through all this effort, and then they think, the gogo think, or the sister, whoever's looking after babies, like, no man, this baby's hungry, when not, just give it some porridge or something else, you know. And then here, so they also need to understand exclusive breastfeeding, how important that is. Have you experienced that, Refilwe? That reality that
have.
Yeah.
I have experienced that a lot. I have experiences from both my family and from my partner's family. So I took a 6-month maternity leave. So I took it when I was 36, knowing that I'm going to be with my baby for at least 5 months, because I knew that they did not believe in exclusive breastfeeding. So I am a stubborn person, I'm not going to lie. I'm very stubborn. When I put my mind into something, I put my mind into it, because I knew that breast milk was nutritious for my baby. So they were all complaining that, you know what, your baby is not going to get enough, it's not going to grow, but my baby is like so big. I've got the most big baby. And it was only from breast milk for 5 months. So they couldn't believe it. Even when they talked to their friends or neighbors, they couldn't believe.
Wow, so you were the living proof. Oh, I love it. Well done. So be encouraged. And then I don't know how you went about educating your family, but you definitely show them how it can be done. So that is really, really great. So support is important. Make sure that the people looking after your baby also knows why you are doing this and why it's so important, and they need to be on board for it. So that is really great. And then you also touched base on the storage of your breast milk. That's a real challenge maybe that you might face, and you might feel a bit shy by putting breast milk in the fridge that the staff is using, or how did you go about that?
Well, I was fortunate because I work in the hospital. So I'm a midwife. I work with doctors, pediatricians. So I was very fortunate because the people I work with, they understand exclusive breastfeeding. So as I said, I would go to the neonatal ward, which has a designated place for expressing. So that's where I would go and express. And I would also donate because I had a lot of milk flow. So I would also express and donate some of the milk. And then the other milk, I would just take it back home
I
with me
love
when
that
I'm
story.
off.
Tell us that story. That's a real great story there. What happened? How did that go about happen?
Okay. So when I came back to work January, I was very anxious on the ward itself because I work in a maternity ward. There's actually no place for workers to express, but there are mothers who are breastfeeding, which is, something that you would quite laugh about. So I went about and went to the neonatal unit, and I asked them that the mothers who come in, because we don't have a boarding home for mothers whose babies are admitted, they just told me that, you know what, the mothers come in, there's a designated place for them. And then I joined them. The patients were very impressed. They did not, anticipate that a midwife or a sister would be joining them to express. So we would sit in a circle, and then we'd get a cup, small cups, which are sterile, and then we would wash our hands, and then I would express with them, hand express, which is manual express when we call it. So I would express with my hand, and I would show them, the ones who were struggling as well, I would show them how to do it. And we were all expressing in tune and talking and relaxed, our breasts out, and, just being relaxed and expressed. So because I had a lot of milk flow, I would donate the milk because I would just come in time and again. Just when I have a little bit of more extra time out of the ward, I would just go in and express and donate. In the neonatal unit, where they just take the milk and then they freeze it, and then it gets pasteurized and given to the neonates, the premature babies.
Amazing.
Yes.
Wow.
So that was my skill.
Oh, I love it. It's such a good story. I mean, it just keeps developing, right? You were determined, you're going to exclusive breastfeed, and then just snowball affected from there. And obviously you were very motivated because you researched this topic. You knew how important it all is. So that's wonderful. I think, Refilwe, there's quite a lot of frustration out there, to be honest. So I think there are lots of moms that are frustrated. They haven't felt supported, they haven't been heard, and all of that. And just a word of encouragement for them, or if they are still preparing to get to work, just a word of encouragement for the mothers out there from your side.
Okay, if you are still preparing to go back to work while you're on maternity leave, trust me, ladies, you are not alone. We are all in this together. Even us midwives, we are all in this together because we go back to our respective. So my words of encouragement is, a month before you go back to work, please pick up that phone, call your manager, ask them that because you are breastfeeding exclusively, how can you maneuver things around? Even the work schedule, can they perhaps put you in a lighter work schedule, or if possible, if you've got the luxury of working in a different area where you are able to express, it will be convenient for you and convenient for your employer, because then you don't have to be absent at work for this and that reason, and you know, all those type of excuses that will come up because now you are going back and forth expressing because your breasts are engorged. So what I can emphasize is call and communicate. Communicate with your manager. If the outcomes are not as enticing or as well packaged as I'm saying, then what I can advise is that maneuver things around on your own. If you can, working with your colleagues, because you are working with your colleagues, ask your colleagues when it's time to express, can I just go out and express? If you've got a car, you can express in your car. Remember, hygiene is always important and storage is always important. So hygiene, sanitize. Storage, you can store in the local fridge, everybody's fridge. I call it everybody's fridge because it's one common fridge. You can just put it there. Just remember to take it back with you home when you knock off. Yeah. So that's the type of tip that I can give you.
Yeah, thank you so much. It's very valuable, and really we have to overemphasize that we're all in it together, and I think that is a real key, you know. And to see this improving in our day and age is that it's a team effort between healthcare providers and moms. We're all women. We're all in it together. We're all going to experience it one way down the line. So can we just support each other, you know, and not and be humane about it. I think what we are saying is getting supported here. There's some comments on our session right now that we can go on to now, and there's a time for some questions. So if there's anyone that has some questions, you can put it in our in the comment section. So the first one, there was someone that said, thank you so much for the session. Just to add, my personal experience is the challenges are in both private and in public sector. I agree. Indeed, the key point is support system, and that is very crucial. It's true that this topic we can talk about for days and days, so we'll talk more about breastfeeding. The going back to work really hits a nerve with me because as a professional nurse, my own colleagues frowned at me expressing at work. I was expected to express in the bathroom, which I refused. I received nasty comments like I'm not the first person to have a baby. There were days when I had to send at least 100 ml at home for my baby to feed because the milk would run out. I couldn't imagine what other mums had to go through outside my profession and without the basic knowledge I have. It really takes more than determination, and though I don't have a formal research, I'd say attitudes and support breast milk feeding affects its success than all the physiological challenges. Okay, that's a complicated sentence, but we're getting the message. Thank you so much for that input. It is a sensitive topic. I think it has been difficult for women. But hey, let's just move forward, and we are going to create awareness, and that's why you came in, and that's why we're talking and doing this talk. I'm excited about this. Is there anything that you want to say to that lovely colleague of yours that has sent in this message?
You know what? The message that I would say to my colleague is that it must start with us, the midwives and the professional nurses. The nursing sector, the nursing education fraternity, it must start with us. We can't be preaching about exclusive breastfeeding to patients where we don't support each other.
Yeah.
It is true what she's saying. Other colleagues are not supportive, but fortunately others are. So it's the determination that you have as a mother, because you know that that milk is nutritious for your baby. So the determination that she had, it was outstanding. So colleagues, it's up to you. Let's be sensitive midwives. Let's go back to the spirit of Ubuntu, because we are because of who you are. That's how it is.
Oh, I just get goosebumps. Thank you, Refilwe. We received some other questions on Facebook. They may be not 100% related to going back to work at this stage, but are you happy to answer them? Shall we try? Yes, okay. So this was a Facebook question that came in a little while ago. I just had a baby. It's difficult to express the milk. So not using a breast pump at the moment. Do you have any idea what to do? And I think it is a relevant question, because there is going to be a point that you should not express milk, and then there's a point that you can express. So let's just unpack this expressing story, expressing milk, and when it's a good time to start expressing, when you should actually not do it, and how can you make it easier if you don't have a breast pump. Can you unpack that a little bit?
Yes. Thank you for that question. Having such equipment as a breast milk pump is actually a luxury. Your hands are the best instrument. So I was fortunate, I had a manual breast pump, but I hardly ever used it. I hardly ever used it. I used my hands. When you can start to express your breast will become full. Around 4 to 6 weeks, your breast becomes very full, because now the flow of the milk, as your baby is suckling, it becomes more. So in between the baby's breastfeeding, you can express your milk. How you express your milk is the very most important. So I'm just going to demonstrate here so that you are able to see wherever you're watching. So you must start on the base of your chest. I don't know if you can see. On the base of your chest, and then hold it in your breast in a C form, just like this. And then you press down to your nipple. Your nipple will become engorged. Don't be alarmed, because your milk ducts are wanting to express that milk out. So you have to just press firmly down, and then your milk will start to flow. Be gentle and go with the pressure that feels right to you. You can also have an express buddy. I call them express buddies. You can have an express buddy, meaning your partner or a close family member who's been living with you, or a close friend can help you with expressing. So you'll be sitting down the way I'm sitting down, and then that person will be just above you. And then they'll be the ones who are gently massaging your breast, meaning putting that pressure with the thumbs, like I showed you, from the chest down to your nipple, and then you'll be holding the cup. Then you will be able to tell them if the pressure is too much, or that if the pressure is just too little. So it must correlate, and you must communicate. So your hands are actually the best instrument If you've got clean utensils, like a bottle that you're expressing into, then you are fine.
I'm so glad you're bringing this up. This is just going really great because I think that is a real concern. I see so many times, even before they had their baby, that I think they need to buy these expensive breast pumps and then they end up never using them. So we're not making friends with the breast pump companies at the moment saying this, but it is the truth. Let us just be real about it, that hand expression can be done, and thank you for showing us. That's really great. We will make sure it gets put out there in many ways and many times. And also I love the fact that you say a breast expressing buddy. That's interesting. It must be someone that you really are close to, that you're allowed to do that and not to squeeze your breast too hard and so forth, hey? But yeah, those are great,
really helps.
Great tips. Yeah. So reviewers, this lady that had a question, she really found it difficult to express, but you showed us how to do it. Can we also just quickly touch base on when is it a good time to start expressing? Because I do think we sometimes express when we shouldn't be expressing in the first 4 weeks. What is your thoughts on that?
I think it will go with your milk production, because some women have a lot of milk production and others they don't have. So like myself, I had a lot of milk production. By the first week, my breasts were already engorged. So I learned how to express. So I had to express because even when my baby was breastfeeding, in between, my breasts were engorged. So I would use a warm cloth, just put it on my breast and allow my breast to be soft and tender. And then the milk automatically, without even expressing, it would just squirt out. Then I knew that it's time to just express, because my baby is sleeping and I'm not going to wake up the baby to breastfeed. So it will go with your body type. But what I would suggest is look at your breast. When your breast will tell you, if your breasts are engorged and are now becoming very painful, it's time to express. Because in between the feeds of your baby, you can express that milk. So listen to your body.
Okay, I hear what you're saying, but I do think we need to point out the fact that how our body works, right? So the more we suckle on the breast, the more a baby sucks, especially in the first time, the more milk your body will produce, because it is on demand, right? So the more we stimulate the breast, the more milk production will happen. So if you have a lot of milk already and you're going to express that milk, it can keep the situation as it is. You can keep, because your body doesn't make the different connotation if it's a baby or an breast pump sucking, you know, or you expressing. So you'll keep making so much milk. So in the beginning, we actually want to not express and let the baby solve that problem. But I hear what you're saying, because sometimes if your breast, especially when the milk, the second milk has come in after the colostrum, that your breast really gets very full, and then a baby battles to suck and it's very uncomfortable. So that is good then to just get it out of a warm cloth, just squeeze some milk out to relieve the pressure. But that is something different than, I would say, than actively expressing milk, right? It's just really more to relieve the pressure and to make it that the baby can actually latch properly. I would recommend, that's what I would say, is to stay away from thinking that you need to express milk at least the first few weeks, 6 weeks or so, and just learn to trust the baby mother cycle that's happening, you know, the suckling and the demand, how much milk you're making, because you need to learn to trust that. Otherwise you feel like you need to measure how much milk is baby getting, and I'm getting too much milk or I have too little milk and all that, those questions. But that's what I said, it can get quite technical, the how to. It was not really the topic of today, but that's a free one that we put in there. All right, so I think
that's why I say listen to your body.
Yeah, listen to your body, exactly. But when you get ready for work, maybe it's good that you start preparing a little bit before the time that you can start expressing, and maybe make a little bit of a milk bank, start collecting some milk if you have extra milk. So those are good times to do express. Okay. All right, so let's see if there's one more question. or a comment. I've got one last comment. I think it's a good one to finish this beautiful session, and it's from Zelda. Do you know Zelda?
Zelda, yes, I do.
You do?
She's my research supervisor.
Yeah, I believe so. She's very proud of you. Yeah. So
Thank
she
you.
says the Department of Health has guidelines on breastfeeding in the workplace, but most employers don't know this at all. So what are we going to do? We're going to find those guidelines on breastfeeding, and we're going to put it on our websites and in our newsletters that you can take it to your employers and let them know about it. So thank you for that, Zelda. I'm aware of those, and we should make the world aware of it too. And let's hope for the best that we will, we are on a good way of awareness and supporting mom. It's all part of women empowerment, and this is so 21st century, hey? Yeah.
Yes, it is.
Yeah. All right. I think we've said most. Is there anything else burning on your heart?
What I can say to women is continue the good job. Expressing or breastfeeding exclusively, it doesn't mean now that you are less of a mom because now you have to return to work.
Mm-hmm.
So do the great job that you are doing. Wherever you're expressing or wherever you are doing the good job that you are doing, continue with it. And then to the midwives and the professional nurses out there, let us develop and become the sensitive midwives and professional nurses that we ought to be. Let us share the information that we have and not keep it to ourselves.
Yeah. And also for the midwives, if I can add there, if you don't feel confident about it, just own up for it. You know, if you feel like you're lacking in the breastfeeding department, there is so much out there you can learn. You know, I'm currently actually doing a breastfeeding course myself, just to make sure that I'm up to date with research. There continue to be so much research. We're working on a course later on this year, since Sister Lillian Center will bring out a course on breastfeeding. So I need to continuously learn myself. So that is part of our profession. If you want to know more about the course, I can link you. But we need to be the leaders on breastfeeding and be the example. So thank you, Refilwe, for being an example. Thank you for walking the talk and showing the way as a mom, as a midwife. We need women like yourself, and I cheer you on, and I thank you for coming in today and for your valuable input. Thank you.
Thank you very much for having me.
You're welcome. We'll be in touch again. Okay.
Thank you. Enjoy your.
So that was us for today. I hope you enjoyed this time together. I really enjoyed it, and it was a wonderful talk with Refilwe, and we learned loads, and we got inspired once again. So that's us. We'll see you next week for the live show. Send this topic on, or send this recording on to your friends that need to hear about us, your colleagues, and let us just keep sharing the exclusive breastfeeding message and support women in this journey. Lots of love. Have a beautiful day further. Bye.